social science, and policy research. Of course, it's also critical to consider the local contexts where research is being conducted. For our mixed methods systematic review, the second phase of our study, we will be looking at different types of barriers and enablers to conducting traditional medicine research across different communities, countries, and regions. These include things like financial issues or political conditions, training availability, cultural factors, including the fact that some communities may have lost trust in researchers. We'll want to learn more about how to improve the quality of traditional medicine research and research synthesis, and how to translate this into policy. Across our review, we'll be engaging knowledge users like yourselves in various ways. We have a project review team that includes experts from all global regions. We will also be holding focus groups and creating working groups to engage stakeholders from different communities. Finally, we've created an online consultation portal where people can provide their input on the issues we are studying. You can access the portal using the QR code or a web link above. There, you can share documents and citations and tell us about barriers and enablers to traditional medicine research. Please do visit the portal so you can contribute to the review findings. And I encourage you again to visit our exhibit here at the summit, where you may learn more about the project. Thank you so much.
Thanks to Nadine for a great introduction and some great work and showing some of the issues we face moving forward with the methodology required for this. Also giving us the word of the day, epistemologic. So I hope you're all going to try and drop that into your coffee break conversation at least once and see if you get a prize for it. So we'll move back on to our live panel at the moment, and our next speaker is S.R. Narahari, and S.R. is the director of the Institute of Applied Dermatology here in India. And a slight change of tact here, where he'll be talking about the introduction of an evidence-based integrative medicine approach for filariasis. Thank you.
Okay, I'm talking about the levels of evidence available for introducing integrative medicine as a public health intervention for biliary lymphedema. As we all know, lymphedema is a global problem. Although lymphatic filariasis, which causes lymphedema, transmitted by mosquitoes, caused by parasitic worms, is a neglected tropical disease. So that is, WHO estimates about 36 million people are affected worldwide. In 2004, we developed, under the mentorship of Professor Terence Rayon, Oxford Dermatology, an integrated medicine protocol which combined Ayurveda, yoga, and biomedicine at the point of care. And therefore, it was clinician-led and patient-centered. We published a community trial in Royal Society Journal. These are the components. You can see in the middle how the limb changes in 2 weeks' time. So the components include the initial nurse-led counseling, where nurse gives all the information about the disease, and health-related quality of life is also taken. And then a skin wash is given. Subsequently, a Fanta soaking solution is, limb is dipped into the Fanta soaking solution, which is made up of different Ayurvedic formulations. Then the bacterial entry points are treated with the Ayurvedic herbal powders. Ulcers are treated with the Ayurvedic oils. Pains go into the yoga later, and then a very good oil massage of about 20 minutes is given. I must say here that all these Ayurveda formulations selected based on Vata, Pitta, and Kapha. And then they go into compression bandage, and that's the result you can see in 2 weeks' time. So, but for biliary lymphedema, there are no very effective treatments available world over. So the WHO says to consider any treatment for biliary lymphedema, it should improve the quality of life, it should reduce the volume, it should reduce the cellulitis, that is biliary fever, and disability reduction. So the WHO New Delhi office commissioned a clinical audit of our patients. 1,698 patients followed up from 2010 to 2009. We did a clinical audit. And the frequency of cellulitis reduced to 0 at first and only 5% in the second follow-up. And these are the triggers or what are called risk factors for cellulitis. These are all 7 are there, like intertrigo, folliculitis. All those things do not have very effective treatments in allopathy or biomedicine. And you can see how the patients improve over first and second follow-up after the discharge. Most importantly, their quality of life improves from the baseline 73% to the follow-up 92%. Most importantly, they are able to go back to their work. This mostly neglected tropical disease affects the poor, so they are unable to work because of the disease, and they are able to go back to their work. Very significant reduction we see is in the volume. The volume is, you can see the volume. At discharge, we see about 25% of reduction with the confidence in 95% CI there. First follow-up, we see further reduction to 1.4 to 2.7%, and second follow-up, further reduction to 1.26 to 3.34%. You can see this patient in 2009, she came at the end of second follow-up, dropped the follow-up, comes back after 12 years, maintaining the same response. That means self-care integrative medicine is sustainable and family member assisted, and therefore it is doable at home. So now we are able to scale it up into 4 centers in 4 Ayurveda medical colleges, 2 in UP and 2 in Bihar. Thanks to Bill and Melinda Gates Foundation, we are able to do it. And there is a response. Patients, all the clinics are already overwhelmed by the patients. Thank you very much.
Thanks, SR, for a terrific example of integrative care. So for our final speaker, I think we'd all agree that there's no topic hotter than artificial intelligence in the world today. We can't pick the newspaper up without reading. While we hear a lot about the dangers of this, of course, there's huge potential for good as well in AI. And Meni Snene, who's at the IDAR, the International Digital Health and AI Research Collaborative in Geneva, is going to talk to us a little bit about the use of AI to assist mapping of evidence for traditional medicine. Thanks, Snene.
Thank you so much, and thank you for this nice invitation to present our work. This is an ongoing project in partnership with WHO, and it's about finding the place of the AI in the traditional medicine. And when we first were tasked with exploring AI and its potential in finding evidence from traditional medicine, my thoughts journeyed back to my time in Tunisia. As a child, whenever I fell prey to cough, my grandparents would come to rescue with their traditional remedy. Although this was part of our heritage, it was galaxies away from what we today can say as a scientific proven remedy. Many of such traditional remedies passed down through generations and might indeed hold kernels of truth waiting to be validated by rigors of modern science. But there's a big challenge. These gems can be buried deep within countless tales and traditions, making it a hard task to filter through and locate which one truly serve and could be a science-based spotlight to be discovered. This is the crossroad where AI comes in as an assistant to tool with its ability to deep dive into vast pools of unstructured data and semi-structured data coming from real-world data. It can help identify potential practices that show promise, steering them towards further scientific validation. AI, with its ability in natural language processing and machine learning, can examine this vast reservoir, transforming it into a more structured data and research-friendly format. The structured data, when combined, creates comprehensive data panorama that can seamlessly assist traditional medicine with scientific evidence-based practices. The result that we expect is that an enriched real-world data that offers a panoramic view of patient healthcare outcomes, transcending the limitation of unstructured data sources that we have today. Finally, through AI's computational power, we can accelerate the discovery and seen patterns, hidden links, hypotheses, and association. In our journey to harness the potential of traditional medicine and AI, our foundation lies in meticulous data collection. We have dived into a multitude of platforms. It's not working. Okay, into a multitude of platforms ranging from well-curated research papers to a diverse set of real-world data, which included patents, clinical trial registries, gray literature, and patient-reported outcomes. To traverse this extensive information, we have implemented advanced natural language processing techniques, specifically a name identity extraction model. That model has proven proficient at pinpointing intricate causal links between different entities. After establishing these relationship between and links between different entities inside of our unstructured data, we have consolidated the data, making it a little bit more structured by using specific scoring systems. We have not only refined our methods, but also expanded to scope to ensure global relevance by making our model multilingual and multi-topics. I need to press. To ensure that our vision is both scientifically anchored and replicable, it was imperative that we first build an ontological foundation for traditional medicine. This foundational step provides a structured roadmap to navigate the flow of data and the information by constructing this ontology. And we are essentially creating a blueprint that clarifies the details of various traditional medicine practices that could be included. This includes aspects such as the social determinant of use, the scientifically identified evidence, anthropological origins, mode of administrations, and the various stage of care. Then we extracted taxonomy of evidence, which served to harmonize terminology from both semantic and syntactic perspective. This allowed us to comprehend how patients articulated their experience and facilitated the extraction of evidence from their narratives. It becomes our Rosetta Stone, aiding in understanding how an individual from India might describe their Ayurveda benefits, or how someone from South America elaborated on the benefit of specific leaves. With this framework established, we integrated several AI techniques. Through natural language processing, we extended our search into vast data sources, pinpointing and extracting these patterns in significant instances. Finally, we mapped the instances onto a knowledge graph. It acts as our compass, unveiling the vast web of connections within traditional medicine, directing our AI to uncover hidden patterns and relationships. Although our project demonstrated promising early results, effectively processing vast amount of unstructured data and highlighting existing causalities, however, we soon encountered several limitations. And one of these essential limitations is that although there is an ample research on integrating AI into classical medicine, our venture into the convergence of AI and traditional medicine is really pioneering. A critical component we identified as missing was the traditional medicine large language model. A large language model is a machine learning model designed towards understanding and generating human-like text based on vast amount of data it has been trained on. It can also analyze and interpret vast amount of unstructured data, transforming it into meaningful insights and structured knowledge. Traditional medicine, with its vast reservoir of practices and knowledge, necessitates a bespoke large language model to encapsulate its depths. Crafting dedicated traditional medicine large language model will not only amplify the accuracy of AI-driven evidence mapping, but also establishes new foundational pieces that paves the way for AI research adventures in AI. Thank you for listening.
Thank you, Mehdi, and a great way to end. We're talking about some of the oldest forms of intervention of medicine, but the fact that some of the most modern techniques could be the way we actually start to look at the complexities in a different way, and we really should think outside the box in the way that we address these large multi-component kind of trials. So thanks to the speakers for really doing a good job of time. It gives us around 15 to 20 minutes open for questions from the floor. I've been asked to kind of move across the room so we don't exhaust the people with the microphones. So perhaps I can take a couple of questions from the left, then I'll move to center, then I'll move to right. So perhaps the lady in white on the left there, I saw your hand go up. If you can address it, if it's in general to the panel, that's fine. But if it's to one of the specific speakers, please do ask and we can let them answer.
Sure, thank you. First of all, I would like to say that it was a wonderful talk and wonderful session. Thank you all speakers. My name is Santoshi Narayanan, and I practice integrative oncology at University of Texas, MD Anderson Cancer Center, US. I enjoyed the presentation from the standpoint of how do we take the systematic review to the next step. For example, right now with Society of Integrative Oncology at MD Anderson and ASCO, American Society of Clinical Oncology, we are working on guideline development so that the gap between the conventional practitioners and traditional practitioners can be narrowed. However, when it comes to systematic reviews, one of the challenges that we see is, for example, I recently did a systematic review and published on medicinal mushrooms and cancer. Many of the studies are region-based. For example, China, Japan, and Korea, that's where most of the studies come from. So my question to the speakers is that, how do we interpret these studies at a global level? And the second question is, how do we all here envision taking the guideline development, which is currently based on the countries, to a global level? For example, we have NCCN guidelines, ASCO SIO guidelines, which applies to American population. Is that applicable to other countries? Do we have enough studies? And if we don't have enough studies, how do we build these studies? How do we conduct studies? So there are so many questions, and if you could address that, that would be very helpful. Thank you.
Thanks. Anybody want to take the first one on systematic reviews? Either Suzanne or please. I see Myung Soo keen to go.
Yeah, thank you for your great question. Regarding to clinical practice guideline, it's very complicated. It includes the contextual, cultural context in translating to one country to another country. And it depends on the clinical question and the member of the clinical practice guideline development, and they decide what to do. And in the case of Korea, we search all the Chinese, English, and other countries' database, not only for Korean, because clinical practice guideline developed in Korean medicine does not mean it applies to only Korean. And we try to find out all the evidence around the world. And we also, in the process of clinical practice guideline, there will be the therapy course process. It means you can discuss internally and which one you take and or delete from in your clinical practice guideline.
Okay, thank you. So yes, there are issues. I think people are biologically the same, whether they're in China or the US or elsewhere, but culturally they're different. And in terms of their medical treatment, that can also be quite different. So for example, last year we published a systematic review of PSK for the side effects of colon cancer treatment. and most of the trials were from Japan, but they were also about 20 years old. And so treatment of colon cancer is now different from what it was 20 years ago in Japan and in the US. So we really couldn't say anything useful about the PSK. So that's an example where it's time more than culture, but there are also examples of culture. So yes, it is quite complex. And if we had a system where we identified a gap from a systematic review, and then we were able to efficiently carry out trials to fill those gaps and answer our questions, I think we'd be much better off. And this is one of the limitations I didn't really have time to go into, but I do think that's a problem with our evidence generation, is that we can see these gaps, but it's much more difficult to fill them in an efficient and targeted way.
Thank you. And quickly, I want to comment on the development of guidelines, which is something that on the global guidelines, WHO has sort of a big history on developing. And I think that we need to be strategic when we talk about traditional medicine, because the first thing to do is to try to disentangle what is generalizable and what is quite specific to one individual, to a certain context. And I think that if we start by looking at the things, if we look at the mapping that Myung-Soo, the one that we have done with Capsin, for instance, across the board, the evidence, are there generalizable interventions? Okay, then we can start by that. Because otherwise, we always receive this pushback that is on traditional medicine is very specific to one individual and a certain context. But we have seen, for instance, with the example of artemisinin, that there are things that can be really for a global effect. That's my first comment on this. Thank you.
Thanks, JP. Let's move to the center block. I see the gentleman at the front here.
I'm Ricardo Gelman. I'm the chair of the Brazilian Academic Consortium, the Capsin, and to be provocative, thinking about the opportunity of that landscape of global perspective, how can we propose to connect all groups that are doing the same maps in different institutions in one same platform? Because there is an overlap of study. We are working in similar methodology, but could be one possibility. I think this is one, just would like to hear from you and compare what's the difference between the methods. Thank you.
Thanks. Why don't we take first to JP, then Myung-Soo. I'm using the time-honored method that if I see the panel nodding their heads as the question's coming, they're getting put on the spot where they're answering it.
Thank you, and I will try to be very quickly on this. Just before the session, we were having this exactly conversation with Myung-Soo and also with some WHO colleagues that we need really from the next few weeks and months to try to coordinate and try to agree in terms of what is the methodology that we are going to use and try to not duplicate and join efforts. I think we are, as I said in my talk, we are in a wonderful moment, and the inception of the Global Center can really provide us with the leadership to continue in this path. Thank you.
Yeah. We can talk later, is okay? Yeah, thank you.
So my question is for Mehdi and also to Mr. Lee. As you are mostly researching and looking at the data that's coming from the Korean ecosystem, and Mehdi is actually creating an AI model on traditional medicine, which would include probably all the global system medicines, including Ayurveda. How do you see, Mr. Mehdi, that both of these are coordinating and you are able to create a model which includes all the major system medicines? And if there are any outcomes that you see that for example, if there are outcomes from Ayurveda that, for example, Koryo can use, or for example, for that matter, even Sowa Rigpa can use. How do you see that? So maybe both of you can answer on that.
One of my slides explain about that. We try to include all traditional medicine around the world and categorize it into some specific intervention, like herbal remedy, and we try to more widely, not to the specifically inside.
Yeah, there's already some internal coordination between our colleagues and systematic review work and the AI work on keywords and specialties that we are integrating inside of our model. I will not pretend that we are including all traditional medicine specialties at all. We are simply focusing on, at the early beginning, this is a project ongoing on herbal medicine, Ayurveda, and which offers a very nice cornerstone of building these kind of AI models, because we have a very scientific foundation and aspects behind it. The idea is to move quickly from the AI model to a large language models, which will encapsulate several other traditional medicine specialties. And that's why we are building this ontology to set up a foundational piece to design and to understand exactly what we should classify as traditional medicine or not.
Thanks. I see the person who's been very patient just in front of you here. Then I'll move to the block on the right. Thanks.
Thank you very much. Thank you, everyone. My name is Kevin Chang. I'm the founder of Kai Analytics. We're a Canadian data science company specializing in NLP as well. So I really enjoyed your talk there. A lot of your graphs resonate with me, and really excited about the work you're doing. I have one comment and I have a question. My comment about the evidence gap map is I use them a lot for my work too. I think they're a great way to tag and gather data. But with traditional medicine, from my experience, patients actually see multiple methodologies. If they see Ayurveda, they might see an ND. And I think one of the limitations with an evidence gap map is you're not able to see the association rules. Ironically, it's a little bit siloed. And sometimes if there's a gap there, it might not be a real gap. It's just not applicable to that methodology. So it might be something to consider. In terms of my question is, I wonder, you've collected such robust data, 240,000, observation points there, and each with different categories. You're building a model on that as well. One of the things is I'm wondering, how do you encourage more private and public partnership in these type of research? For example, I have a great team, but some of these data that the WHO publishes, they're just high level. We're not able to access some of the raw data. And I partner with a lot of universities that are eager to kind of work with these models. And I think there's a lot of opportunities to kind of collaborate more. And I was wondering, what venues are there right now for more private-public collaboration? Thank you.
Thanks. Maybe we should start with Myangsu, and then JP, did you nod your head on that? Maybe just nod your head a lot, and I'm going to pick on you.
Yes, this data it may be available in the web if there is no copyright issue, and the method is similar, and I think it depends on the question. It's like the systematic review, and you can see it will be uploaded in WHO after some process, and you can access all the data. And it will be helpful. Yeah.
My comments is very minor. I think that integrating the different sources of evidence, we still need to refine a bit further the methodology to bring all these different types and traditions of evidence together. And just want to note that particularly on Ayurveda with Cabsin in Brazil, there is an ongoing work, a map going on with 32 identified systematic reviews specifically on Ayurveda. Yeah, thank you.
Thanks. Okay, we'll consider you as part of that block, and possibly the last question coming on here before I round up. Thank you.
I'm Mitali Mukherjee from Indian Institute of Technology in Jodhpur. I wanted to ask you a question regarding your ontology. How are you bridging the ontologies of different knowledge systems? So do you use a framework like the human phenotype ontology to be able to connect and make it interoperable? How is it that you're bridging ontologies?
So from a technical perspective, we are using OWL. So that's the implementation process. How we end up with the ontology, this is undergoing work that need to be validated. It's not yet at that stage, and it's the early draft that we have shown. The design was done in a recursive manner. We started from extraction of keywords and taxonomy, building high-level representation of this taxonomy, getting the building blocks inside of the taxonomy. What are the constituents of the taxonomy, and then going back to the keywords to see if all or major descriptions of the elements that we have extracted fit within the different blocks. So we have done some spiral refinements, starting from text, ending with the design, till we have a proof model that could contain major elements of what we consider a traditional medicine description.
Thank you.
Great, thanks. I'm going to take the chair's prerogative in the last 2.5 minutes to bring in somebody we haven't heard from, and that's SR, as a practitioner who's using this. So perhaps your reflections out to the audience. We're talking here about mapping what we know and how do we learn more. What do you need to know? What is your experience? What would your take home to this audience be?
As a practitioner, I would say that we need to get more training. People who are interested in integrated medicine need to training on the traditional medicine. We need to work with traditional medical practitioners. We need to understand what this science is. So reading is very important. And then allopathy structures need to be imported to structure the data, the clinical science. Essentially, it's the clinical science which is traditional medicine is. So allopathy is also clinical science. Let us look at the clinical evidence rather than looking at the molecular evidence. Structure the clinical evidence using allopathic models, merge it with Ayurvedic or any traditional medicine. This is how we have won.
Thanks very much. And you bring me in with 30 seconds to spare on our part of the session. First, a notice, and I am told that the plenary will start at 4 p.m. in here. Yep. And my last and very pleasurable duty is ask you all to thank the fantastic panelists for sharing their experience with us. Thank you, and enjoy the rest of the discussion.
I remember feeling really afraid 2 years ago when I was gasping for breath, feeling like, I didn't know what was happening to my body and I was no longer in control. I consulted lots of allopaths, the family doctor, specialists, they ran a whole bunch of tests. They said that I was allergic, probably to dust, but that it couldn't be fixed. And so I decided to consult a homeopath. He told me to start yoga. I had to incorporate exercises for my lungs within everyday regular activities. I have young kids, so he said, blow balloons every day, that will help strengthen your lungs. And with homeopathy, it's mind plus body. So you're playing a more active role. You're observing, you're making changes, you're reporting back, you're checking in. And particularly pranayam in yoga, and to make sure that it's something I did every day, not just to strengthen my lungs, but also to de-stress. This entire journey with traditional medicine has made me realize that there is a very strong connection between our mind and body. You have a role to play in your own health. You can make choices that impact how your body reacts or responds or heals. A lot of it is in your hands. And I love that.
The most stressful part of what I do as an athlete is that first round jump when I'm at the top of the runway. Being based in the UK, being like born and bred in Manchester, I have certainly been brought up with a very conventional mindset around medicine and healthcare. I'd literally had 2 years of incessant injury, 2 surgeries within the space of basically 12 months. And I'd had enough. I really wanted to seek out healing, and that healing wasn't just a physical healing, it definitely was an emotional, spiritual, mental healing. Some of the important practices that I do personally to focus on staying healthy would be making sure that I go out and do my meditative walks in the woods or in the forest, even in the park nearby to my home. I think it's important that we realise that conventional and traditional medicine can go hand in hand. You can't keep giving, going hard 100% of the time, because ultimately you're gonna burn out. I have this rhythm of rest, recovery, performance, rest, recover, performance that is part of my day, my week, my month, my year.
What has been for centuries the integral source of health for people and communities? What is still the first port of call for millions of people worldwide for their health and well-being? Its traditional, ancestral, and indigenous knowledges of health and the world around us, constantly evolving, in balance with self, in harmony with nature. But how can we harness its potential to help us address the health challenges of our busy lives? To turn the promise of health for all into a reality for all. To deliver people-centered health services that are respectful of cultures and traditions. By sharing our knowledge and experiences of traditional practices, we can understand, acknowledge, and advance its role in building a fairer, safer, and healthier future. Respecting the wisdom passed down from generations and embracing science, technology, and innovative thinking. Blending traditional and conventional, underpinned by robust evidence, innovation, new technologies, and sustainability. Imagine if we combine the best of the modern and the best of the ancient, harmony with health, societies, and nature. It can be done. Together, we can embrace the potential of traditional medicine and create a healthier, more sustainable, and balanced world. What has been for centuries the integral source of health for people and communities was still the first port of call for millions of people worldwide for their health and well-being. Its traditional, ancestral, and indigenous knowledges of health and the world around us, constantly evolving, in balance with self, in harmony with nature. But how can we harness its potential to help us address the health challenges of our busy lives? To turn the promise of health for all into a reality for all. to deliver people-centered health services that are respectful of cultures and traditions. By sharing our knowledge and experiences of traditional practices, we can understand, acknowledge, and advance its role in building a fairer, safer, and healthier future. Respecting the wisdom passed down from generations and embracing science, technology, and innovative thinking. Blending traditional and conventional, underpinned by robust evidence, innovation, new technologies, and sustainability. Imagine if we combine the best of the modern and the best of the ancient to support harmony with self, societies, and nature. It can be done. Together, we can embrace the potential of traditional medicine and create a healthier, more sustainable, and balanced world. What has been for centuries the integral source of health for people and communities? What is still the first port of call for millions of people worldwide for their health and well-being? Its traditional, ancestral, and indigenous knowledges of health and the world around us, constantly evolving, in balance with self, in harmony with nature. But how can we harness its potential to help us address the health challenges of our busy lives? To turn the promise of health for all into a reality for all. To deliver people-centered health services that are respectful of cultures and traditions. By sharing our knowledge and experiences of traditional practices, we can understand, acknowledge, and advance its role in building a fairer, safer, and healthier future. Respecting the wisdom passed down from generations and embracing science, technology, and innovative thinking. Blending traditional and conventional, underpinned by robust evidence, innovation, new technologies, and sustainability. Imagine if we combine the best of the modern and the best of the ancient to support harmony with self, societies, and nature. It can be done. Together, we can embrace the potential of traditional medicine and create a healthier, more sustainable, and balanced world.
Our culture and our land are in our bones and in our blood.
Traditional medicine holds great potential. Let's recognise that these are our inheritances for our future generations.
We are part of the solution, one that will benefit all human and planetary health.
It's very hard to be healthy on a land that's screaming out for help. Humanity cannot be well when we're not caring for what looks after us, and that's our planet Earth.
For Indigenous peoples globally, our concepts of health are holistic. Our health is also dependent on the health of our family, our community, and our land. So much so that it cannot be separated.
We kind of lost the connection we had with nature and with different ways to approach health. It's not like you have to choose medicine over natural ways of approaching health.
I think it's important that we redress the balance so that it's not all one thing or the other, but actually that we can find a beautiful middle ground.
Medicine comes from a culture, from a geography, from a place, from a people, from a need, from a climate.
Traditional medicine matter to the people of Africa because this is our culture, this is our future.
I think it's important that we realise that conventional and traditional medicine can go hand in hand.
Today there's more reliance on Western medicine, and what we do need to have a really strong forward-looking, progressive way of being able to recognise the medicines of millennia.
Que no se pierdan esos saberes propios, nuestros, que son tan sagrados, que son tan nuestros, que es la esencia de la vida del ser humano, de estar conectados con la diversidad de pueblos, con la diversidad de nuestras semillas, con la diversidad de nuestras plantas, con la diversidad de nuestras aves.
Yoga is basically an ancient Indian practice. Yoga brings out the positivity from within, it improves our mental well-being, and it brings out the overall well-being of an individual.
TCIH is about more than just medicines. We need research on professions and practices more than just products.
We as Indigenous peoples know that our intimate and intricate understandings of our lands and our medicines have so much to offer everyone.
It's now time to recognise the opportunity that we have. It's time to turn on our ears, open our eyes, open our hearts, and understand where we need to go to together, collectively.
This is move it.
Yeah, back and forth. Easy.
Check, check. On, okay. Okay. Those of you who is already in the room, could you please be seated so that we can proceed with our plenary session to as quickly as possible, as we already behind time considerably. Yeah. Good afternoon, distinguished delegates, ladies and gentlemen. Welcome to the second plenary session of the WHO Traditional Medicine Global Summit on Country Data and Global Evidence. My name is Anjali Jutaputhi, and I will be your moderator of this session, which will take about 75 minutes. The objective of this plenary session is to provide the global status of the progress of traditional medicine via situation analysis and the WHO global survey and country data provided by member states, with insights on regional trends and glimpses of best traditional medicine practices that selected countries and WHO regions have integrated into the health system. We have here, as you see, 10 speakers and representatives from 4 WHO regions to give intervention in our session. Therefore, to keep our session within 75 minutes, kindly hold your question until the end of the session. And to start the session, I would like to invite the audience to participate in the guess the statistics quiz, answering 4 selected multiple choice questions on the global status of traditional medicine using your mobile phone. And I'd like you to turn on your app, WHO event app, go to the page on Global Summit. In there, you would see the poll and Q&A. Poll and Q&A, you just tap on that. And then in hall 4, there will be polling. So you go in there. Wait. Don't give the answer. Please. Please. Uh-oh. Just give the questions. Uh-oh. Please. The team with the question and then let people answer before giving the solution. Uh-oh. I mean, people already answered? Oh, okay. Then, the first question is, how many member states have a national traditional medicine program? This, I would say that, as you know, that the WHO has published the WHO Global Report on Traditional and Complementary Medicine in 2019. So the information that we would like to ask from you is based on the survey conducted in 2012 with the supplement on 2018. So the first question is, how many member states have a national traditional medicine program? And many of you answer A, right? A, 48%. So give the hand to yourself. This is a correct answer. Yeah. Then we move to the second questions. How many? Oh, I see. You have to, this one. Hey. Seven. No. This is the second question. Okay. Second question is how many member states have a national traditional medicine office? How many have? Majority answer 56 member states have, 61%. Okay. More on 75, 25%, and okay, 98, 10%, and 107 is only 10%. Okay. The answer, the answer is actually 107. So the least of you answer correctly. You know? So quite considerable number of member states have the a national traditional medicine office, which is officially mandated in carry on anything in charge of traditional medicine issues. So any country that have the office would usually move fast. Question number 3. How many member states have a national policy on the traditional medicine? Nobody answered. 98? Oh, okay. Have a national policies mean it's the role that government in the development of traditional and complementary medicine in healthcare systems. They have objective and goal. So majority answer 75, 98 member states, 32%, 124, 17%, 19%, and last one, 170 is 8%. Which one is the correct answer? 98. So 31% of you answer it correctly. 98. 98% would account for 51%. So about more than half of the member states already now have the policy on traditional medicine. Do you know how many member states WHO have? 194. So if you like a ballpark, like half is 87. Then if you want to know whether it's more than half or lower than half, then 87 is the half number. So it's 98%, which 35% can answer correctly. Now we come to the last part. In what year did WHO establish the traditional medicine program? 1976, 1985, 1992, 2002, or 2014? Okay, still voting. Okay, most of you answer 1992, 44%. 21%, 1976. Okay, increasing now. Yeah, okay. 1985 is 15%. So which one is the correct answer? 1976. Yeah, we have started the traditional medicine program in the WHO for quite a long time. 47 years, and we have come a long way, no? 47 years, and I think when we start the traditional medicine strategy, the next one, it would be about half a century, 50 years. It would be about that. And we have come so far, but still we have a lot of things to do in the future, right? Many things to do that we gather together to try to bring the policies into practice. Okay, thank you very much for
medical sciences. The aim is that they would generate robust evidence from not only clinical trials, but also the mechanisms, the basic research, the relationships, the omics of different, using the most modern approaches possible to also study and also conduct implementation research once we find something is efficacious. And they will also work towards adapting research methods for integrative health research. So in about creating an enabling ecosystem, we did an analysis of the gaps and the difficulties that were faced by researchers who wanted to do integrative health research. And we found, first thing we said is, if it is supported by at the highest level between the Ministry of Health and Family Welfare, of which we are one of the two departments, as well as the Ministry of Ayush, that would give confidence to people. Very important to have high-level buy-in. Our Honorable Health Minister and the Minister of Ayush both blessed this, this initiative. Adaptations in research, bioethics in particular, they were found to be one of the difficulties when these studies were being assessed by ethics committees that did not have any traditional medicine experts. So since the Department of Health Research has all the bioethics are registered, bodies are registered with us, and we do the guidelines. So we have made guidelines for integrative health research where it is mandatory to have experts of both modern medicine and traditional medicine in ethics committees when they discuss integrative health care research projects. Similarly, there are issues with a regulatory framework in terms of getting approvals, and that we are working with the Drug Controller General of India's office. And lastly, and importantly, adequate funding support for research, which again, as I said, we have decided to support not only the research, big research projects that I talked about and the research centers, but also other funding initiatives. So in terms of research capacity strengthening, as I said, was a felt need. We already have several basic research methods, online courses of ICMR, National Institute of Epidemiology, which are mandatory for all medical college faculty and postgraduates. And we've decided to extend these to the Ayush faculty and postgraduates if they want to become more adept at research methodology. In addition, we have decided to have two types of workshops, clinical and epidemiological research methods, where it will be all joint workshops, where the Ayush Ministry will nominate selected researchers, and we will conduct multiple such workshops over a period of, let's say, each workshop lasting 2 weeks, on similar lines as the research training methodology workshops that WHO used to have. Advanced integrative health research methods. So we will be working and developing these to say what are the issues and how do you conduct in the best possible way integrative research, which will be, as I said, jointly developed, and then we will train other researchers on both the Ayush side as well as the medical side. So the way forward is to accelerate this integrative health research agenda nationwide. We are starting with the premier institutes, but that's not where we want to stop. We want to encourage a lot of other institutions, medical institutions, to also conduct integrative health research. We want to use these research findings to update guidelines for clinical practice and public health programs in India. And finally, extend this integrative health research to newer areas such as artificial intelligence, precision medicine, etc. So that was just to share our experience and what we are, a journey that we've just started. Maybe in a couple of years, we will be able to give you more insight into the results. So thank you very much.
Thank you very much, Dr. Rajiv Bahal, for your insights on the integrative health research to develop evidence to support the integrative use of both conventional and traditional medicine for people's health. This initiative is really interesting indeed, and it's really commendable. Next in our session, we'll have 3 speakers who will talk to us about the activities that WHO and member states conducted and is each currently underway to obtain information on the current situation of traditional and complementary medicine in the WHO regions and in the world, to assess the results of the implementation of the current WHO traditional medicine strategy. First, we will hear about the results of the studies undertaken by the Ministry of Health Malaysia for the WHO, analyzing the status and situation of traditional and complementary medicine in primary health care for the Southeast Asian region and the Western Pacific regions of the WHO. Originally, it was planned that the Director General of Health, Ministry of Health Malaysia, Dr. Muhammad Razzi bin Abu Hassan, will present this work to us. But unfortunately, he could not be with us today. So today we have Dr. Goh Cheng Sun, Director of Traditional and Complementary Medicine Division, Ministry of Health Malaysia, to deliver this study on behalf of Dr. Razzi. Dr. Goh, please.
Thank you, Dr. Anchari, for your kind introductions. So, ladies and gentlemen, a very good afternoon. First and foremost, I am here speaking on behalf of my superior, Director General, Dr. Razid. So, because he's not able to attend this global summit, he would like to tender his apologies. Because due to the ad hoc method, he needs to attend immediately. So that is the reasons he requests me to deliver this presentation, these important presentations to every one of you. So, ladies and gentlemen, in fact, this is a situational analysis of the traditional and complementary medicines in primary healthcare in Southeast Asia and Western Pacific regions. TNCM divisions in a capacity as a WHO collaborating center in traditional, complementary, and integrative medicine work together with WHOs to do this survey. So in fact, how you say, this is the outline of my presentations. So this analysis is to assess the current landscape of TNCM in primary healthcare, identify challenges, and document the best practices in the selected member states in the Southeast Asia as well as the Western Pacific regions. In fact, we have selected 20 member states. Unfortunately, only 15 member states able to attend. So we would like to focus on this 9 areas. I think governance of TNCM, healthcare facility offering TNCM services, TNCM practitioner density and distribution, availability of TNCM services, quality of TNCM, role of TNCM in public health initiative, best practices of TNCM. Then we will end with issue and challenges and way forward. So ladies and gentlemen, based on all these important areas, we have, engaged with the 15 member states. In fact, how is this methodologies have developed? First, we engage them through the inter-regional meeting, through the knowledge sharing. Then we gather the information, of course. After that, we also disseminate the field question. Field question means that we gather the info, fill up the question, and send back to the focal point and ask them to verify it. So with that one, they will give us the feedback. Then on top of that, we also do the desktop search, okay, in order to have a wider or broader picture, so a more complete picture. So we have done the desktop search and we compile all the data, we analyze it. So these are the 15 member states participate in this. So as just now I have mentioned, we will focus on the 9 areas. First is the governance of TNCN in primary healthcare. So you can see that the full integrations country, there are 7 member states full integrations, if I'm right, and 8 are partial integrated, and 2 member states do not have integrations of TNCM in the primary healthcare. There are Brunei and Maldives. So inclusions of TNCM in primary healthcare in their national healthcare services, from here, the data analysis show that 10 out of 15 countries have these inclusions. Then, as well as we also look into the